you most likely have a loved one in your life who's got diabetes, or a cousin or an aunt or an uncle or someone who's affected by this. What is diabetes? So there's two kinds of My word. How's it? And welcome back. Today we're going to be doing diabetes. We're going to be asking why, what, how, and if. So why diabetes? So diabetes is a world crisis at the moment. You probably know someone with diabetes. You might even have a cousin or an aunt or an uncle with diabetes. And the fact that it affects everyone, we really need to know what we're dealing with. So what is diabetes? There are two kinds of diabetes. The first one, which would be type 1, which is what we used to believe is where someone is born with diabetes, they're 2-3 years old, and they suddenly have issues with their sugar. Type 2 diabetes would be something that is something you get later on in life because you've been eating badly or whatever the case is. But this is really not true anymore. Type 1 is where the pancreas, which is the organ in the body that creates insulin. Insulin might sound really complicated, but all it does is it allows sugar to move from the bloodstream into the organ or the cell. So it's the key that opens the door. If you have no insulin, you can't use sugar. So type 1 diabetes, there is no insulin production because the pancreas has been damaged by itself. Long story short, the pancreas is no longer producing any insulin in type 1, and that means that the person needs to inject themselves with insulin. This can happen when you're a kid. This can happen when you're in your teens. This can happen later in life. It can happen at any point, and it means that you're having to inject yourself with insulin, or you have a machine that pumps insulin into your arm, whatever the case is, and they have to maintain their own sugar levels with their own insulin. So therefore, they're acting like their own pancreas. So type 2 is when you've been mistreating your pancreas, or you've been eating badly, or something else has happened, and the pancreas is now not making enough insulin, or you have become insulin resistant. The key doesn't really open the door, and so now you need more keys to open the same door, and so you need more insulin, and the more insulin you have, the more resistant you get to it, and therefore you're not actually able to use it well enough. That your doctor might put you on medication that makes you less resistant or pushes more insulin out of your pancreas. Either way. All right, so how are you going to deal with diabetes? So you can either have high sugar or you can have low sugar. If the blood sugar is very high, they have hours to days to deal with it before it becomes a real crisis. If you have low sugar, they have minutes to hours, because the lower your sugar drops, you can have seizures, you can stop breathing. All of these things are super critical. So there is the saying, hot and dry, sugar I die, cold and wet, sugar I get. So hot and dry, sugar I die, means that if they feel hot and they feel very dry, their sugar is probably high. Hey, I didn't even plan that. And then if it is cold and wet, sugar I get, it means that if they feel cold and they're wet, their sugar is probably low. I know it sounds a bit strange, but it can be a real good tool. I use it whenever I have a patient who I think has low blood sugar, because they can present in similar ways. They can be conscious or semi-conscious, and the family says, oh, they are diabetic, and you go, oh, they're very pale and they're very wet, they've been sweating and they're very cold, sugar's probably low. If they're very hot and they're very dry, their sugar is probably high. But like saying this, you need to get a machine and you need to test the sugar. The family will be able to test, or the paramedics will be able to test. This is all just for first aid information. So how are you going to treat high and low sugar? Well, you can do nothing about high sugar. If they're awake and they're conscious, you can get them to drink water, because that dilutes. If they have low sugar and they are still semi-awake or semi-conscious and they're still talking to you, they can drink something with sugar in it, Coke or chocolate or jam or whatever the case is. It's a good source of quick energy. If they're unconscious, remember, this is a lot more complicated. If you come across someone who's unconscious and you think they're diabetic, remember hazards, hello, help, airway, breathing, circulation, always. Once you've done all these things and they're breathing and they're unconscious, you're going to turn them onto the recovery position. There's a video on that. Once they're in the recovery position, what you can do is that you can push jam or something that's very sweet with lots of sugar, honey, into the sides of their mouth, not through their teeth. Never put anything in the mouth. It's in the cheek. You can shove stuff in between the cheek and the gums outside of their teeth, and that'll slowly absorb. Remember to be very careful. Don't put any liquid in their mouth. They will choke. They will drown. Don't put any food in their mouth. They will choke. These are hazards. Don't put anything in their mouth. Just something sweet on your finger if you have a glove. Sugar, honey, jam, whatever it is. Get as much as you can into their cheeks. It will work. It's slow. It's very slow. But if you're far from help or help's on the way and you don't know what to do, this works. Remember, if their sugar is low, they have minutes to hours. If their sugar is high, they have hours to days. So if you're with someone, they're unconscious, they're diabetic, you don't know what their sugar is, it's probably low. And if it's high and you give them some sugar, it's not really a hassle. But if it's low and you give them some sugar, you might just save their life. Hope that's helpful. Remember, there is a quiz at the bottom, and I hope that was helpful. See you guys in the next video.